Okay, so we're going to apply a cardboard splint to the patient's right leg. So this would be considered a rigid splint. Now this one is actually not put together completely, so you can fold it in. As you can see, it's kind of pre-cut. You can take tape, and if you don't have tape, then figure out how to keep this thing together. You might even want to use a bandage or something to just kind of tie it together. But pretty much you just want to kind of get it so you can use it and so it doesn't fall apart. Alright, now what you're going to do is you're going to take this splint and we're going to say that the lower leg is fractured here. So remember, we want to immobilize the joint above and below the site of the injury. So for that particular injury, the joint above is the knee and below would be the ankle. Now, this really should be a two-person operation. So your partner will support the leg, upper and lower, and lift up just enough for you to slide the splint underneath. You slide it underneath. And if you have a lot of space in between the limb and the splint itself, you can take towel or any kind of padding and just kind of pad it for them and make it more comfortable. Now what you notice is this splint is above the knee and it is certainly supporting the ankle. So you've done what your objective was to immobilize the joint above and below the injury. Again, you can use tape and you can tie this together so it's just a little bit tighter and not so bulky. And never go over the site of the injury or the potential injury, meaning if I had bone exposed or anything, I don't want to put the tape right over that particular area. Now you have the splint applied. Go ahead and check for your capillary refill again, making sure the circulation is good to this limb. And this would be considered a nice rigid splint and probably giving a lot of comfort to this particular patient. So now what we're going to do is we're going to splint this patient's right lower arm. We have identified that there is a potential fracture here. So remember that capillary refill, which we did earlier, is telling you what's happening with the circulation. It's a good idea. Go ahead and check that, make sure everything's okay. Same idea, rigid splint. We want to immobilize the elbow and the wrist. So your partner, once again, can support the arm as such. You're going to lift it up and you're going to place the splint underneath so that you are supporting both the elbow and the wrist. And very important is to leave the fingertips exposed so that you can check for color of the skin, temperature, and capillary refill. Now we've been showing you capillary refill on the thumb, but just remember you can do it on any digit of that hand and it's the same reading. You can use tape as we did with the leg splint, but I want to show you, in case you don't have tape, you can use roller gauze if that's all that's available. And pretty much you're just going to come underneath. And remember, all you're trying to do here is support and get this splint onto the patient so that it's a little bit more comfortable and it's providing the rigid support for the patient. Okay? And so we'll go ahead and we'll do it like that. Now we have the splint applied. This is your triangular bandage, and when you open it up, you notice that it's in the shape of a triangle. If you take the pointed end and you make a knot, this will become your anchor point. This knot will go behind the elbow here so that you can put the sling onto this patient. Now this is a little bit more difficult when the patient is lying down. However, now that this fracture is splinted, you're able to lift the arm and manipulate it a little bit easier. Put the knot behind the elbow. Bring this up like this. And you're going to have the bandage up against kind of over the chest area. And then what you're going to do is you're going to tie this behind the patient's neck. Okay? And you don't want to put the knot directly behind the neck in case, you know, they're lying down like he is. You don't want it to be uncomfortable. For this particular demonstration, they're limited in the motion here, the movement of the joint, because it's a mannequin, but understand that in a real person, you'd be able to get the limb across the body a little bit better. You can tie it in a knot or a bow, whichever you like, whatever works best. And then remember that with this particular sling, you want to make sure that you're supporting the arm as best you can. Because you have the splint, it's not as important that this come all the way up to the hand area, because you have supplied that rigidity. And then same thing, go ahead and check your capillary refill. Anytime you manipulate a limb, you always want to make sure that the circulation remains good. So what we've done today is we put on the rigid leg splint, and we've applied the rigid arm splint with a sling. And these are just a few of the things that you would be doing as CERT members. And if you really want to get involved in the CERT program, today's the day to do that.